So tell me your perspective about dentistry in college and in our practice. What did you learn from us?
When I graduated from college, I didn't get the seat I wanted and my rank was not very sufficient. I wanted to sit back, but I was very insecure about the fact that what if I lose practice from dentistry? This academy provides you with patients, whereas in other academies you didn't have a patient exposure. You had only dummy models, only mannequins you did.
Hello viewers, today we have Dr. Raashmi with us. Dr. Raashmi graduated from Ramachandra Dental College and she worked with me for the last 1 year. She also completed her endo course with us, and today we are going to ask her feedback and her dreams and goals about dentistry. It's going to be an interesting video. Please watch fully. Hi.
Hello sir.
How are you, Raashmi?
I'm good sir.
So tell me your perspective about dentistry in college and in our practice. What did you learn from us?
So, we were the COVID batch in final year. We didn't get to do a lot of RCT cases. So when I graduated from college, I was preparing for my NEET exam, and I didn't get the seat I wanted and my rank was not very sufficient. So I wanted to sit back, but I was very insecure about the fact that what if I lose practice from dentistry, like in the course of studying, what if I lose practice? So I wanted to join a clinic and I thought I'll pursue my MDS further later on. So when I joined here, I handled cases and I saw different kind of patients. I used to do filling, extractions, and I even did CD. But I was insecure about the fact that I didn't know RCT. Like I didn't know the concept of RCT. I was scared of even doing an anterior. Even in college, I have done like hand files I've used in college, but I haven't done in Rotary. So I got this interest of doing RCT. I asked sir one day, sir, I want to join academy as many doctors. I was also constantly motivated by the fact that this academy provides you with patients, whereas in other academies you didn't have a patient exposure. You had only dummy models, only mannequins you did. So I inquired and then I asked sir one day, sir, I want to join Malligai Dental Academy for a root canal course and I'll pursue this, sir. He also happily agreed, and that's how it started. Yeah.
And Dr. Raashmi is a very intelligent doctor. She has prepared very well for her exams, and we wish you all the best for your MDS.
Thank you so much.
We believe in you and we know definitely you will crack it. The best part of her is like she's very vibrant and very active person, and she is very open to all learnings, whether it is theory or practical. I want all of you who are watching this, you should understand dentistry is a balance of both knowledge and skills. The more knowledge you have, your eyes will be able to see things better in clinical dentistry. There are a lot of doctors I know, they focus only on doing cases and doing some practical on the patient's mouth. But I would tell you, as you learn and do, you will enjoy even more, because the more you learn, the more your eyes can see, because they say the eyes and the brain are connected. So your eyes will be able to see things very clearly. For example, when you want to give LA, if you know the theory of giving the right IAN block and the mental block, say for example lower anterior, I have seen people giving bilateral inferior alveolar. Definitely it will work, but what happens is when they do bilateral inferior alveolar and also they give mental. So what happens, such people when they want to open the mouth, they want to do a bilateral procedure, it will be very difficult for the patient to rinse the mouth and move the tongue and talk. Whereas a simple way to handle is just give 2 mental blocks and a lingual block and a buccal infiltration. You don't have, the patient will be having more control. See, doctors who have studied more of LA, they will be able to understand this. Likewise, apply your clinical knowledge, like the theory knowledge in your clinical science, it will be better. And second case will be, we have done lot of cases together, okay, like veneers and things like that. What you have to focus is all the theoretical aspects, they will have some impact in your practical part. So for example, what is the concentration of the hydrofluoric acid, what is the etching time. See, when you do and then you go back, it's easy. You know, okay, you have to etch for only 10 seconds and you have to wash it for 60 seconds to leave all the remnants. So when you learn as an MCQ, it's difficult to remember, but when you do practically, you will know, okay, without doing this, this is not going to happen. So this is what I want to advise all of you. Even after you get your MDS, I want you to keep learning these basics which you are doing, whether it is anatomy, physiology. This will be very helpful. Okay, and I want to thank people like Raashmi, and especially Raashmi, because they keep me very young. They challenge me with questions and we discuss lot of MCQs, and even when I'm writing my MFDS exams and all that, she used to coach me with certain points, like she studies well and she tells me in gist. So she's like a Google for me, when I put some input, she gives me an output of, sir, this is his point. So I learn by hearing, my auditory learning type. So I retain the information much better when somebody teaches. Raashmi, I personally thank you for that. And I thank your family also for supporting, because her father is so dedicated to pick her up every day. And without family support, this courses, job, everything's very difficult, I'm telling you. For dentistry, parent support or in-law support or your husband support, spouse support is very mandatory. And I hope, I want all the viewers who are watching this should learn how Raashmi did her course here. Like she joined as a doctor, then she wanted to go and upgrade her skills. Now she's preparing for her NEET. We wish you all the best, doctor.
Thank you, sir.
And anything you want to tell us? Okay. Thank you so much. Have a lovely day. Bye.